I'm Natalie Kunsman, MD, and today we are talking about melatonin. So, melatonin is a chemical compound in our body that's actually secreted by the pineal gland, which is a very small pea-shaped structure in nearly the center part of our brain that secretes the melatonin in response to light and darkness, so that it's actually triggered to secrete in darkness, and it is inhibited or slowed down in its secretion by the light. So we need tryptophan to actually convert to melatonin at the pineal level. So diet winds up being very important because we need that amino acid and from the protein families to be able to manufacture it in the first place. Now, there are several receptors in different tissues of our body, so that implies that there are multiple functions of melatonin in the body above and beyond the usual one to help us go into our sleep cycle. So the receptors are obviously in the brain, the cardiovascular system, the kidney, the liver, and the intestinal tract, and even some more as we find out down the road. So we have found some other benefits of this wonderful molecule. It is a potent antioxidant, and it forms complexes with cadmium, copper, and aluminum, but at this point we're not quite sure what that implies or what that is necessary for or what that benefit would be. It does have a role in the immune system because it behaves as an anti-inflammatory, and it can, to that note, protect from neurodegenerative conditions. Now, there's some lesser known, or I shall say more recently known benefits of the melatonin, such that it can prevent acute pancreatitis. And then there is a role in the fat cells because our fat cells have some receptors, and I will say that also poor sleepers wind up being obese. So I think there's a connection that poor sleeping will lead to obesity, but also low melatonin itself, which has a direct effect on the fat cells, may be contributing to obesity, and there will be more of that in the future to vet that out. So we also have found that there may be some benefit with headaches, such that the cluster headache variety can respond to a degree favorably with melatonin to quiet down the headache. Now, it also shows some decline in the Alzheimer's patients, such that it will slow the decline of the memory and the trickle-down effect of Alzheimer's by using some melatonin. And we find that there may be some limited benefit, although there, with tinnitus, which is some ringing of the ears. Now, there are some cautions with this compound. We would like to use it a little cautiously and less frequently with a diabetic patient because there may be some interference in the way sugar is metabolized, so use it cautiously. There may be an interference between it and ACE inhibitors, so again, we are using it cautiously with those people on ACE inhibitors. And we may not be using it in transplant patients because it is an immune modulator itself, and most transplant recipients are on immunosuppressants. Now, we also found that melatonin could potentiate or aggravate restless leg syndrome at nighttime, which is yet another sleep condition. So when I am advising people to use melatonin to aid in sleep, I typically will recommend 1 to 6 milligrams. Now, in the cancer world, there is some very exciting new information that has been out in the past 10 to 15 years that we can use it adjunctively with cancer treatments such as lung, breast, colon, kidney, and brain tumors. So there is a benefit to those tumors, but now if we are going to use it adjunctively, we're talking about much higher milligrams, such as 10 to 40 milligrams. And I will caution that if we're going to use those kinds of dosing strategies, you will need a physician who is integrative, such as me, to help advise you on that. Again, supervision of melatonin typically isn't necessary for the sleep disorders. However, if we are using it to aid in the cancer treatments and its other side benefit to help prevent some of the radiation side effects, consult a physician. Again, Natalie Kunsman, MD. This was a brief talk on melatonin, which is something we all need. Please subscribe to my channel below, and until we meet again, be well.